Welcome to another Facebook and YouTube Live, and my name is Keith, and I'm an innovative educator that really is passionate to help empower educators to bring practice back into a practice-based profession, to help educators develop tools, create resources, and practical strategies to develop clinical judgment that our students need for both safe practice and licensure. And I'm just excited to have you with me tonight. I want to thank you for taking time out of your busy schedule to just spend the next half hour, 45 minutes or so, where I'll just kind of engage with you, answer some questions that have been asked in the Facebook group. Teachers Transforming Nursing Education, bring some best practices and questions related to Next Gen and clinical judgment, and we'll close with talking about the science of learning and some best practice principles to really make learning stick using adult learning theory and bringing those principles into our content, into our classroom. And so it's great to be with you tonight. I'm here from my home office here in Andover, Minnesota, a northern suburb here of Minneapolis. We had a beautiful, kind of rainy day today. But again, just want to thank you again for joining me tonight. Just love to know who's out there tonight. So, I see Darlene. Thanks for the shout out. I see Helen in Central Pennsylvania. What a blessing to use social media in a real positive and powerful way to connect with educators. And really, it's my passion, again, just to serve your needs. And it's my pleasure to take time out of my schedule tonight to be here with you tonight. And so if you haven't been to a Facebook Live here, I do this about every 2 weeks, every Thursday evening. And, my goal, is to just, again, provide you with those practical strategies, tools. But the Facebook group that I've been blessed to be an admin for is called Teachers Transforming Nursing Education. And if you're not a part of that community, and it truly is a community, it is a supportive environment where almost 8,000 educators from the United States, Canada, and other parts of the world are basically connecting with each other, supporting each other, because you can't implement needed change alone. We got to do it together. And so I just love this group, and I'm so proud of the great work that they're doing, really supporting and encouraging each other during some of the most difficult times. And, if you can't make this, you'd like to share our conversation tonight, I'm going to present some very powerful and practical strategies that will really empower you, so stay tuned. But if you like this and you want to share it with colleagues that weren't here, there's a link that this resides forever on Keith RN. Think Like a Nurse is my Keith RN page. And so go there, and right underneath the photograph, under the banner, is a video header. Click it and you'll see all the links. I've been doing this now for a year. And so this literally is my 1-year anniversary of doing probably about 30 Facebook Lives about every other week over the last year. And it's been an incredible journey. And I just, again, want to thank you for joining me tonight. 2 weeks ago, we talked about practical principles of self-care for the educator, and really how can we support each other during these very difficult and challenging times during the pandemic. It has been an incredibly stressful time. And, one of the educators in the chat, her name was Christy. She shared something I didn't see 2 weeks ago, and it's worth shouting out. And I really wanted to share Christy's heart that she took the time to share to kind of begin our conversation tonight. And Christy said this: I almost quit being a nurse after 5 years. I was overwhelmed, understaffed, and burnt out trying to take care of my patients the way I had been taught. I got into nursing to make a difference in people's lives. I had a supervisor on the night shift whom I shared my feelings with. She said something that changed my nursing career and said, Christy, you can't make a difference in all of the patients you've been assigned, but you can pick one patient and do something life-changing for them. I've since followed this advice. It's been revolutionary. I now have had time to do that same thing in nursing education. I give all of my students my best. Just as I have a chance, I pour into those who need extra help or at the moment find them in my presence. Just sharing my presence, it feeds my soul. And I love this principle because it really kind of highlights the starfish story. You look at our students, you look at nursing as a whole, we look at the struggles we're facing, and it seems overwhelming. But, like Christy said, who's that one that you can make a difference with? Who's that one that you can connect with? And just like in that starfish, the one that you can throw back into the ocean, you made a difference for them. And I think we need to remind ourselves as educators, you are making a difference. I look at the great work that you're doing, and I know that sometimes, our students, they're struggling, they're stressed out, they don't see the work that you're doing. And, this is really challenging because the very first kind of thing I'm going to highlight today is talking about student evaluations. The month of May, for many of us, it's the end of a year. Some of us have summers off, but also it's a time for those dreaded and sometimes feared student evaluations. And I think that when we get some really hurtful feedback, it can really destroy our soul. We wonder, are we even making a difference? Do I even want to continue down this path? And I just want to encourage you all tonight, who's listening or who's watching this, you are making a difference, and stay true to your why. The reasons that you were attracted to become one of the few, the proud, the nurse educators, because that's a harder road to hoe, in my opinion, than clinical practice. Though they both have inherent challenges, nursing education just doesn't leave you. It's always with you. There's always something to do, and the challenges never end. But you are making a difference. And I just want, if you need some encouragement, reach out to a colleague that's working with you. Share your story. You need to support each other. The Facebook group is great. Social media is limited, though. You need that face-to-face with those people in your department. And so I want to encourage you to just draw upon those relationships and those supportive community that you have in your departments, because you need to share your heart. Some of you are really struggling tonight. Some of you maybe don't even want to teach anymore. It's that real, and I get it, and I understand it. But you are making a difference. There's a reason you're a nurse educator, because it's your passion, and I believe it's your God-given purpose. For many of you, it's your calling. Be faithful and true to the reason that you began this journey. You got your master's degree. Some of you have your doctorate degree. That didn't come easy and without cost. Don't throw it away. Don't let the challenges you're facing tonight or in this, journey keep you from your purpose. And so I want to start with I look at the Facebook group as closely as I can as the admin. I love to follow the trends, the chats, what people are saying. And, I had some prepared things I was going to share, but today there was a post that was posted, and in 5 hours, it had over 100 comments, separate comments by educators. That's viral in our social, in that group. That is a blowing up post. It's touching a nerve. And this was what the educator said. She said in her post, "How do I overcome student evaluations of me? It seems to be always that one who says the absolute worst and untruthful things in an evaluation. I am working in class today, trying my best to be as sweet as a pie, knowing what they really think of me. Do I confront a student who I know wrote a specific hurtful comment? It is so far from the truth." And that elicited a lot of painful comments. And even one educator got really angry. I'd like your thoughts on this. She said this: "The evaluation system in nursing education in itself is unethical in every way. In no other profession are employees allowed to be berated and assaulted in such a manner with comments. Half the comments are untruthful and written out of spite by entitled students, yet they are allowed to launch very personal attacks anonymously." If you have some thoughts on this topic, I'm going to keep my eye on the chat. I'd love to just kind of see if you have anything that resonates with you. But, my goal is to look at evaluations and use them as opportunities, because this is what another educator said. So I'm going to kind of look at some of the feedback that other educators are sharing, maybe some that you're thinking, because we have to come to a balance and a perspective that can, like every educator must do, and every student must do who's a nurse, needs to reflect. Does it fit? And here's some comments from another educator. If all your evaluations are stellar, you aren't challenging them. Your job is not to make them like you as a friend. You have to have a teaching-mentor relationship, and that takes some of them out of their comfort zone. Being their best buddy will get you great evaluations, but isn't necessarily the best for their learning. And that's a tension I think we all face as educators. We want to be liked. When I was a new educator, I wanted to be liked by my students, but I soon realized that being liked is the same as being a friend. I want to be tough, and I want to do what is needed so that they are the best. And that sometimes means I'm not going to be liked because I'm challenging them, like with active learning. When I wrote my first case studies almost over 10 years ago now for my classroom, they didn't love them. Not everybody. Not everybody still doesn't. Educators are still saying, my students, they resist active learning. But again, we have to do what is best. And we as educators need to embrace educational best practices in that journey. Here's another thought from another educator who said this: I focus on the things that I can change. It's typically the students that don't do well and want to blame the professor and post in such a negative way. You can't please everyone. I'm not trying to be their friend. The highest compliment I can get is she's tough but fair. So put a positive spin and see where you can go for improvement on your part. And one educator had a really powerful feedback, and I kind of like this. It's like clinical reasoning. Look for the trends in feedback. Just like how you look for the trends in clinical data. Where's my lab values going? Vital signs, etc. Look for the trends in your feedback, not just one. That's where we've got to kind of let go. There's always going to be that one. She says, look for themes. Use the curve model as a rule of thumb, kind of like a bell curve, except that the first 10% are always going to have gripes. They've got a chip on their shoulder. Let those go. 80% are in the middle of that bell curve. That's who you're shooting for. And the other 10% are going to be as negative as well. Focus on the 80%, she said. Keep them engaged and support each other. As long as you've got them, you're fine. And I think that's really important. Just the principle that I remember from my student evals, because they weren't stellar either. Bottom line is I looked for themes, and I looked for more than one of the same comment. So when I saw a trend in evaluations, I reflected, and I kind of had to own some of that because I was growing as well. I was a novice educator. I had room for growth, as we all do. And so look for those trends. As you look at evaluations, and I love the feedback from the educators, I just want to highlight, but I would say absolutely look for the trends, look for opportunities for growth. If you're just getting one that's like really vicious and personal, that's basically spit that one out. Spit that out, and you won't be devastated. I've seen educators in tears in their offices over evaluations. I know how painful it can be. But again, we gotta look for the trends, find that 80%, do your best. And as long as you're giving it 110%, like I know we all do in nursing education, you've got to kind of just let it go sometimes. You can't control your student feedback. But I also think it's an opportunity in our programs to use evaluations as a tool or as an example of civility, of respect and boundaries, that we need to provide guidance to our students that just basically, to dump in your evaluation is unprofessional. Let's provide some professional guidelines to our students before they fill out evaluations. Let's talk about respect, civility, sending the mail to the right address. If you've got a concern, address it during the semester, not in your evaluation. So there's opportunities to grow and to share those experiences, but let's kind of use it as a object lesson for civility and what professional behavior looks like. And there was a blog link that an educator shared. It was called, in the Facebook group, it's called What to Do About Those Negative Comments on Course Evaluations. And so I want to encourage you to take a look at that. Very simple blog, but very powerful. And, I've been blogging as a nurse educator now for about, 8 years, since about 2012. I wrote my first blog on my website, KeithRN. And I have a blog that's one of my most popular. And I just kind of just did this simple strategy, but it's called Developing a Personal Mission Statement. And really what it talks about is helping our students to develop their why as a nurse. But in the process, I also turn the page, kind of turn it around to educators and say, what is your why as an educator? Write it down. Just like every organization has a personal mission statement. Why? It basically tells them what their purpose is. What is their reason for existing as an organization? We as educators, our students need to do the same thing. And so Amy's put a couple links in the chat. I want to kind of look at those and just take a look at those. And these links will be on the live stream link as well after this video, after this live stream is over. So please take a look at them and, really encourage your students to identify their why as well. We need to do it as educators. What we need to do? Put it on our office, kind of like we do with our name, or on a plaque or something, so it's with us. We can remind ourselves of our why, because let's just be honest, we lose sight of our why, we begin to run dry, and we basically are in danger of basically drifting and kind of losing our sense of purpose and our anchor. So anyways, thanks. That's kind of that's what I wanted to share on that aspect. I'm just kind of looking at some of the comments here. Kendra said this. My first year, I'll just kind of pop it on the screen here, said my first year evals were very hurtful and untrue, but I decided to take the critiques I thought I could improve on and work on those. I think you just have to do your own self-evaluation. If I know I have done my best and improved in areas, I've lost a little bit more there. Let me just kind of see what the rest of it says. If I've done my best and improved in areas that I need to, then I'm at peace with that. And absolutely, Kendra, thanks so much for taking the time to share that beautiful comment, and really just kind of highlights that, just doing your best, and you got to just let it go and take it a step at a time. And so, Donna said, I was fired because of student evals. 3 students who failed both the ATI and final wrote letters to the VP. And, Don, I'm sorry about that. And one of the things that really concerns me in nursing education is the weight that student evals sometimes have in our programs. That, really when you look at it, our students are novices. We are expert practitioners, and we're in varying degrees of progression as educators. Since when does a novice, inexperienced student have the ability to even know what they don't know regarding nursing as a profession, how it should be taught? We need to, again, make sure that we're balancing student evals with peer feedback and evaluations, that we're having peers evaluate our performance in the classroom, and that should be given the highest weight. And I know in some programs, the culture is very different, and that really needs to change. We look at the transformation in nursing education. There's a lot of things we need to really advocate for. And one of those is basically giving educators control of their program completely, listening to feedback, respecting students, but they shouldn't be driving the bus because they don't know what they don't know. And that needs to change if that culture is present. Just my thoughts. If you have some thoughts, you have a chat. I'd love to hear it, because, my goal is not to just kind of get on my soapbox. I want to know what you're thinking as educators as well. And let's have a conversation and let's have some dialogue. I just want to facilitate that and have some fun at the same time. And so if you have some thoughts or comments on that, I'll be looking at that. And so I'm going to keep going, but I'll keep my eye on the chat. And I'm going to start with the first question that I basically asked about 3 days ago in the Facebook group. And it was this: what questions do you have about Next Generation NCLEX? And I want to get a sense as far as what don't you know, or what are you struggling with? And, one of the educators was very honest, said, I am scared of Next Gen. It's going to be a challenge. And, I want you to know that if we're using some standard principles of educational best practices and some practical strategies, I'm going to share a couple with you tonight. No fear. of Next Gen. And another comment that came through with that question is, what's the best ways to incorporate Next Gen questions in the curriculum, and when should they be implemented? Now, what I want you to recognize is this, is that really when we're talking about, let's kind of hold the Next Gen a little bit loosely here. Remember that we're not teaching to the test. We're preparing students for practice. And let's look at what a Next Gen question is. It's a case study. Now, what I didn't realize when I began writing my very first case studies as a novice educator back in 2011, before there was even a Keith RN, and I just read back Dr. Benner's work that I want all of you to have on your shelf, Educating Nurses, a call for radical transformation. Dr. Benner advocated that we need to, again, bring context to our content. We just can't teach information. It has to have a context, and we need to bring clinical and class together, bring that reality of clinical practice into our class, and we need to emphasize the thinking and action skill of clinical reasoning. And there's no powerful strategy that's no more powerful than a well-written, simple case study and your case-based scenarios. And so when we're talking about Next Gen questions, let's just I just have a question for you, and I'd like to get your feedback. How consistently are you implementing case-based strategies or case-based scenarios into your classroom? They can be Keith RN case studies, they can be ATI case studies, they can be Whittingham. What are you doing to bring cases in general into your practice in the classroom or post-conference? Because that's what we really want to drill deep on. The Next Gen NCLEX questions, we'll talk about that in just a little bit, about just the structure of them, the kind of questions we should be asking. But my question is, are we implementing and integrating case studies into those resources, into all that we're doing? And so when we look at that, let's start with a case-based scenario. If you're looking at your evaluation, we oftentimes are looking at the complicated next generation formatted questions. And what I want to encourage you to look at is just kind of recognize that a select all that apply question that our students hate captures the essence of the higher level reasoning questions that Next Gen represents. And so, we don't need to have the technology of these latest and greatest resources or using Canvas, Blackboard, ExamSoft, and getting Next Gen formatted questions. We're losing sight of the real issue. What we need to develop are the processes of clinical reasoning that lead to the correct outcome of a clinical judgment that can't be taught directly. And so let's kind of look at, using case-based scenarios in our classroom, in our clinical setting, and just simple strategies to integrate next generation or clinical judgment. Let's kind of get away from this next gen, next thing, everything related to Next Gen. Let's avoid this disconnect between practice and academia. And let's just say, let's develop clinical judgment using case-based scenarios derived from your lens of practice. So let me share a practical strategy to do that. It's called the one image cue. Let's say you're teaching some really important content on post-operative care, surgical incisions, and you're giving them the need to know information, keeping it concise. Now it's time to pause in your PowerPoint for about 5 minutes and bring in clinical judgment. Bring in the clinical reasoning and the thinking in action using Tanner's clinical judgment model. So here's an example. You on your PowerPoint, you put on a nice image. Now that just took me out of the picture here for a minute. But again, look at that image carefully. And looking at that, this is a patient who had a surgery 2 days ago. You as the nurse, you remove the dressing of the abdominal wound from the open appendectomy, and you note the following. Now, what we want to do with this image, and you can do this with any image that you are teaching in your program. What you want to do is take an image And now you want to do 4 questions that are all based on Tanner's clinical judgment model. Now, I want to just reiterate Tanner's clinical judgment model. And I have a video that I did, a YouTube video that's gotten 6,000 hits. Hasn't gone viral yet. Maybe it will tonight. But it's about a 7-minute video that is going to be in the chat here in just a moment. That just is called Developing Clinical Judgment. And it just makes Tanner's clinical judgment model practical and actionable, because that is a practice-based framework of clinical reasoning. The NCSBN model should not be the curricular model. That should not be what informs everything you do as your clinical judgment framework. It's a test model. It was never meant for practice. It's never been researched or validated for a practice-based model. Let's avoid that error of, again, focusing on a model that is an evaluation model, but not practice. Tanner's is. And it's only 4 steps, not 6. So it's a little simpler. But here are the 4 questions you want to use with that image. So let's pop on that image again. Let's remind ourselves, here's our image. And now we're going to ask 4 simple questions. And I want you all to write these down, because you can capture the essence of clinical judgment, the clinical reasoning of Tanner's framework as it relates to how a nurse reasons in the real world practice setting. So here is the, whoops, let me get my that image off I think I still got that there. There we go. Get it off. There we go. Very first question with that image, and this is true with any image, is noticing. That's the first step of Tanner's framework. What do you notice? So let's look at that. What do you notice as a nurse? It's reddened, but this is the question. Is it reddened too much? Is it the stitches are approximated? Do you see any drainage? And again, you could break your students out in small groups in your classroom and just have a nice little, 30 seconds. What do you notice? And you could even build on that saying, what are you concerned about? What is most concerning in this image? Again, it's using the same kind of questions that you'll see in Next Gen, but more importantly, these are reflective questions nurses use in practice, and these questions should also be incorporated into your clinical paperwork, so that these questions become a repetitive, ingrained way of reasoning. So our first step of Tanner that aligns with assessment of nursing process. As you collect data and assess, what are you noticing? And again, some redness, some irritation. Now, does it look excessive? There's some ambiguity here. So this is going to be great discussion in your classroom. Don't make it like a obvious, gory incision or an obvious problem. Put some ambiguity. Make it kind of real world practicey. This is not necessarily infected. This is kind of borderline. Now, it's concerning, but yet it's not necessarily you've got a problem, but you got to watch it carefully. Second question is this. Interpreting is the next step of Tanner's judgment model. What do you notice as you look at that? What's your interpretation of the data that you notice that's concerning? Is it expected or unexpected 2 days after surgery? And again, reflect on that. Have your students discuss this. You'd say, well, it is red. Is it too red? Have some discussion. You as a faculty are having fun, because now you're not teaching. You're just guiding student introspection and reflection using Tanner's reasoning, steps of noticing. Then what are you interpreting from your assessment? The third step of Tanner's framework of clinical judgment is responding. What is going to be the response by the nurse, which is in essence the plan of care? What is the nursing priority? What is the priority nursing intervention? Do we have a problem yet that we need to contact the physician, for example, as our next step? I'll let you decide that. But again, that's step 3. And these questions can be used in the classroom, in your clinical paperwork, and then in your test, in your evaluation for your testing. Start bringing in a simple image, a simple statement of a scenario, and then have these questions of Tanner's framework aligning with them. What are you noticing? And then have a select all that apply, and let them pick and choose. what they're noticing that's concerning. The step 2 of interpreting, make that just a multiple choice of just 4 or 5, and then 1 is correct. And now you've got responding, have maybe 2 interventions that are relevant, but there's 1 that's the priority. Make that a multiple choice. Keep it simple, but it's high level thinking. Again, we want to develop the thinking and not focusing on the technology of these really cool 2-column, 3-column matrix multiple choice and hotspots and highlighting. If they know the reasoning processes, you can kind of leave the technology. You can start doing this right now, tomorrow in your classroom. 4th step of Tanner is reflecting. Reflecting, in essence, is reflective evaluation. And in essence, a very simple question to reflect on and say, did the patient respond as expected? As you look at reflection, how will the nurse know if the desired outcome was achieved? What is the outcome we're looking for, and was it achieved? What does that evaluation data look like? And so again, we're just taking a repetitive 4-step process, like nursing process is 5 steps. We can really kind of see how the essence of Tanner's framework aligns with this. And what I want to kind of show you in closing of just this kind of this thought here, this is a great infographic from ATI that I really love. And because what I want you to do is focus on what is in the upper, kind of at the 1 o'clock position. On the outer rim is Tanner's clinical judgment model and the 4 steps of the reasoning process of noticing, interpreting, responding, reflecting. The next line is nursing process. And then the inner aspect is the NCSBN model. And what I want you to see with this is that this is showing how the noticing of Tanner's aligns with assessment of nursing process, aligns with analyzing cues of NCSBN. And what I want you to see with this is that Tanner's practice-based model of clinical judgment captures the essence and highlights the reasoning frameworks your students will need for understanding and enhancing nursing process, and applying that to practice, as well as the NCSBN model. We can focus on Tanner as a practice-based, evidence-based, research-based model of clinical judgment that's been published in the literature since 2006. It's been validated by Lassiter's clinical judgment rubric. There are many prominent educators right now saying, teach the NCSBN model. And I say, don't do it. You don't need to. You don't want to teach an evaluation model. Let's teach a practice-based model. And it's a win-win when we incorporate Tanner's framework. And so if you have some thoughts or comments, I'd love to get them and share your thoughts. And Helen, you asked, where can that wheel be found? That is on ATI's website. And I apologize, I don't. If you were to Google this, if you were to Google Next Generation NCLEX ATI, you will find this, you'll find an article and you'll find this rubric there on that web page. And so maybe next week, next time I come in, I'll present that. Otherwise, I'll try to find it here while I'm presenting, but I can't promise you. I'm a guy, I multitask very poorly. So I'll stay focused on what's in front of me here right now. But I want to encourage you, use the 1 image cue as a practical strategy. And this was something that when I went to Nuts and Bolts with Nurse Tim over a year ago, this was one of the strategies that they shared. And you know what? I love it. And I would just expound upon it using some of the reasoning questions of Tanner would be the way that I would flesh out this 1 image cue as a practical way to bring a case-based approach using a scenario that highlights a patient body part or an assessment finding that will be something your students will see in practice. And that's kind of our goal. We want to bring that context into our content. And so let me just kind of keep going here. And, so I kind of talked about already some of the aspects of Next Gen. That's kind of what I wanted to highlight today for Next Gen. So let me get that graphic off the page because now you can't even see my face. There we go, which is not a bad thing. But that is something that that wheel really just hits it home. And Amy, if you want to look on the ATI Next Generation and see if you can find that and put the link in the chat. I've got a friendly helper here tonight who helps me get all these links in. So I'm going to delegate that to Amy and to have her take a look at that. What I want to close with tonight is looking at how we can embrace best practices of the science of learning to make our knowledge and our learning stick. One of the challenges we face in nursing education is that we give our students too much information, we don't contextualize it, and it gets lost in the weeds the next week, the next day even. Most of it's forgotten. And so we need to kind of use the science of learning, the way our brains were created and designed, how they learn. And in the last couple times, I'm just going to highlight in just 1 minute 2 other science of learning strategies. And I'm going to build on that with adult learning theory tonight and just briefly highlight that for you. But situated cognition, big words. But really, Dr. Benner uses this in educating nurses, and that's one of her science of learning theory she advocates. But situated cognition is real simple. Meaningful, deep learning must have a context for it to be applied and then retrieved from the memory bank. It's kind of like a scaffolding or a hook that when you bring a case study, you bring an image like I just shared tonight. You know what? You're going to make that learning stick. It's going to be retrieved. They're going to remember that image, and you're providing a context. That situated cognition informs us that just giving your students the regurgitated PowerPoints from the textbook publishers are a disservice to our student learning. It's weak, ineffective learning that is quickly forgotten. We must do better. And I hope that someday our textbook publishers give us less information that is meaningful and most important, not 100 slides per chapter, which is what I've typically seen, unfortunately. So situated cognition, he's got my soapbox going. Hope you don't mind. That's situated cognition. Cognitive load theory is another simple theory that just simply says this. There's only so much information on your frontal cortex you can hold before it starts dripping on the floor. And so in essence, you have a limited amount of retention. You can't remember everything. That's why less is more when it comes to knowledge acquisition, making it stick. So let's bring context to our content, but then let's teach less so our students remember more. It's really counterintuitive, but it's using the science of learning, basic principles of the sciences of learning theory to enhance our practice as educators. And let's embrace this motto of Lowe's: never stop improving. We can always be better. And so tonight I'm going to close with adult learning theory. And adult learning theory, is really just addresses, Knowles, Knowles was the originator of this theory. It's really how adults learn. Adults learn differently than children. And so our students are adult learners. And so therefore we need to teach and use strategies that align with how adults learn best. And here's what adult learning theory informs us. Adult learners are self-motivated. Now, sometimes we kind of look at our students and we kind of say, really? They don't want to read the textbooks. And sometimes some of that is just stress, and some of it may be a little bit sloppy, but we need to raise that bar for them. But it's that they are self-motivated and they prefer self-directed learning. That's why online education, when it's done well, can really align with how adults learn, because it's self-directed. They choose when they want to watch your PowerPoint that you posted. Make sure it's relevant and concise, though. They also love problem-solving activities. Now, recognize this. Case studies and even that image is a problem that needs to be solved. What is it? Is this infection? Is this normal? What do I do? Those are problems, clinical-based problems. Adult learners value problem-based learning and those principles of problem-based learning. So let's bring it into our classroom. Let's bring in the images. Let's bring in context. Let's bring in some concise scenarios from clinical that we had last week into our classrooms. Let's talk about that. Adult learners also like to learn from prior life experiences. They bring in multitudes. Some of them are, middle-aged. They're older than me, and the bottom line is they've got life experiences that they can draw upon. And they tend to have a higher engagement in learning when the information presented is relevant and applicable to the subject at hand. I have been blown away by my adult learners in classroom when they can kind of recognize, even intuitively, that certain things don't really seem that relevant to them and they're novices. You know what one of those things was? Nursing NANDA diagnostic statements. They would question the validity and really, is this how a nurse really thinks? And I had to kind of be honest with them and say, not usually. Some NANDA statements do fit, like acute pain, chronic pain, but even my novice inexperienced students could smell something with NANDA that really wasn't that relevant. So our students who are adult learners, they're looking for relevance. That's why the case studies that I've written from my lens of current practice in those scenarios are real. They're salient. They represent best practices using Tanner's framework and open-ended questions. And they see the relevance and the buy-in is there. And that's what the feedback that I get from educators. But you all can do the same thing with whatever you use in your strategies. Make sure that it's relevant, real world, and keeps it real in our practice settings. So when we look at some practical strategies, how can we then kind of look at, okay, how can we teach differently? With kind of applying adult learning theory. Let me give you 4 little bullet points. Number 1, they like choices to determine how they would like to learn. So now we're faced with the dilemma in nursing education. Do we keep teaching online? Or do we basically kind of look at going back to traditional and they get no choice? Our adult learners like a choice. I think they should be in class, by the way, not virtual if we don't have to. So let's kind of make that happen if we can. Just kind of my 2 cents. But again, they like choices. Number 2, adult learners need to transfer learning from their past experiences and draw upon what they already know to improve the context of current learning. So really, we need to be intentional as educators to scaffold that early content of pathophysiology, for example. Let's bring it back into the next semester's med-surg, into our advanced med-surg, into everything we do with perfusion and cardiac output equals stroke volume times heart rate. They must understand that and they must apply it. So let's keep bringing in those principles and transfer prior learning into our current content. Third principle, don't emphasize memorization or excessive information. This violates adult learning theory, but we're oftentimes guilty of it. So let's stop that. Let's, as educators, you have the power to change you and to change the way you teach. And so it's my passion to just kind of encourage you, to empower you to be that needed change. Let change begin with you. Don't look at your other colleagues. You worry about you because that's the only person you can change. Just a thought. And so let's not emphasize memorization. Let's use problem solving and clinical reasoning skills to apply learning to solve clinical problems. So again, case-based learning, whether it be case studies, statements, images, bring case-based realities into your content wherever it may be. We have to teach knowledge, yes. They must know the knowledge, but then they have to apply it. And that's where your case-based approaches and practice-based strategies are going to rocket for your adult learners. And finally, communicate how learning can be immediately applied and implemented to provide patient care. This is where they need to see the relevance. So if you're teaching them any content that might seem a little out there in the weeds, it's kind of abstract to them, bring it back to how they're going to use this formula. So for example, cardiac output equals stroke volume times heart rate. Let's talk about early signs of shock. Let's talk about our patient who's bleeding internally and nobody knows it, but their heart rate's going from 90 to 110. Their blood pressure is still normal. Is that a problem? Yes or no? if they know that formula and you can apply it to patient care, now you've made it stick. Now they're going to recognize this in practice when they graduate from your program, and they're going to be a superhero and save a life, because they recognize, oh, I remember that. Cardiac output, that's early decompensation. This patient could be bleeding. I need more data. I should call the doctor. Let's get a lab. Let's get a hemoglobin. And they get it and say, oh, it's dropped 2 grams. We got a problem. Boom. We've rescued. The failure to rescue in clinical practice is a failure to recognize relevant clinical data that was not noticed. The first step of Tanner, by the way, begins the reasoning that a nurse must possess to think like a nurse. So anyways, yes, thank you so much, Helen, I'm glad you found that infographic and we got that there. So I'd love to get your feedback from tonight's presentation and these thoughts. I'd like to know, what were your takeaways? I want you to put them in the chat. If you have a closing question, you got time. It takes about a 30-second delay for me to see it. So I want to see your thoughts. But we look at takeaways. We want to there's 3 that I want you to never forget from today's 45 minutes we've had together. Number 1, remember your why. Develop your personal mission statement as a nurse educator, and don't let those evaluations rock your world looking for those trends, but know your purpose. Remember your why. Write it down. What was it that caused you to leave practice and get your master's or your doctorate? There was a reason. It may be forgotten. Number 2, takeaway. Never forget the importance of contextualizing your content throughout your program using case-based learning. That's the foundation, and it's an educational best practice. I'm not advocating case studies because I write case studies with Keith RN. No, I write case studies because they're an outgrowth of educational best practices advocated by Dr. Benner and her colleagues in educating nurses. And I'm a nurse in practice at the bedside, and I just use my lens of practice to keep it real with the scenarios that I've written. It's just best practice. Let's embrace best practices. And I have no agenda whatsoever. That's my agenda, best practice. Number 3, emphasize the problem solving, relevant content, focus on what is most important. And so I'm going to close with just one final thought. Just want to let you know that I've written probably in collaborating with about 110 case studies that have available inside my all-inclusive membership, Think Like a Nurse. But I've got a free case study on keithrn.com. It's on COVID-19. It's got a student version, an answer key, and I've got some other free resources on my website as well that can help any educator be the needed change. So if you want to look at just kind of a completely developed unfolding case study, get that COVID-19 free download at the top of the homepage and see what you think. I've also got, again, 110 case studies with multiple levels of complexity on my all-inclusive membership for nurse educators, thinklikeanurse.co. And Amy will put that in the chat. And I've got webinars, handouts, different levels of complexity, PowerPoints of the case studies to really help educators, again, present this information to your students. And it also has Tanner's clinical judgment model aligned within these cases. And I did that about 8 years ago, way before Next Gen. Didn't realize it, but I was ahead of the curve. And so these case studies use these same questions and many more that I've shared with you a little bit earlier today with that image cue already in the case studies with open-ended questions. And so I've also offered departmental memberships at a discount. I offer department or faculty individual memberships with that, as well as departmental at a significant discount. And so if you're looking for active learning resources to strengthen clinical judgment, I've got a banquet for you, a buffet that you can pick and choose. Different case studies for almost every content across the curriculum. With 110 cases, that's a really good start. I don't think anybody has that kind of selection for you in nursing education. And also with members, I have office hours tomorrow morning from 10 a.m. to 12 noon Central. You can join me in my Zoom video conference. You'll get a link in your email. For those of you that are members, if you have a question, you want to connect with me personally, I'll spend the time that I need to connect with you and empower you. So just want you to be aware of those resources. And in closing, I would love to answer some questions out there that are there. So let's kind of start with what I see here. Susan said this: What is the best way to start incorporating clinical reasoning in nursing fundamental clinicals? Susan, that's a wonderful question, and I'll answer that for you. What we want to start to do, Susan, is do a two-part dance. And this is true for all of us in nursing education, by the way, that first semester. When we are teaching assessment, when we're teaching nursing process, and we're teaching assessment skills, unfortunately, our students who are concrete novice students, they just see the task of assessment, head to toe. Oh, I have to do this in the eyes, have to do this in the mouth, have to do this in the lungs. They see the task. And so, Susan, what we must do is then bring in Tanner's framework and simply just, we don't have to even talk about Tanner. You know Tanner as an educator. You're just going to say, okay, students, you're collecting breath sounds. You always are asking yourself, what are you noticing from what you're collecting that is important to the nurse or might be concerning or is expected or unexpected? Those are all nuanced ways of fleshing out, Susan, the noticing of assessment in nursing process. We just kind of need to dovetail and align Tanner's framework with nursing process to basically heighten the reasoning, the thinking, because as professional educators, we're teaching professional nurses the higher level reasoning skills. They must always not just look at assessment and the assessment collection gathering process as a scale, as a task, even like when they're in the clinical setting and they're basically collecting all the data. Are they just filling out the paperwork? Or are they looking at it differently, saying, what am I noticing of what I'm writing down that's relevant, that's important, that is concerning? That's what we want to teach, Susan. So wonderful question. I hope that was helpful. Melissa said my new motto will be context for content. Melissa, I love it. And Dr. Benner would be proud to hear you say that. She's my hero, and she is, I love it and would encourage you to do that. And so Carmen says, when you say it, it makes much sense. Implementing is harder, but I'm embracing. And, Carmen, we need to embrace the harder path. It's like nursing education is hard. And I think that sometimes we as educators make it harder than it has to be. We don't have to be the fountain of knowledge. We're the guides on the sides. Remember this, that nursing and teaching and learning is a 50-50. As educators, we teach. We give our 50%. It's kind of like a good marriage. We give our half, and we're going to give it 110% of good teaching. And that's my passion, is to help you, guide you to some of those just best practices. But then our students need to do their half, equal, of learning and applying themselves. And that's where we are the guide on the side, Carmen. So we don't have to embrace and do it all. So I hope you embrace that hard and broken. It's not a broken road. That's a country music song. We're not going to go there. But it's a hard road. And I thank you that you're embracing that. And so April says this, my takeaway was to remember that the Tanner model is the best practice model. Love your COVID case study, April. Thank you so much. And, when you look at Tanner's framework, just remember it's the best model because it's a practice-based, research-based, evidence-based model and it's a theoretical framework. The NCSBN model is none of the above. It hasn't even been tested as a model. The model itself has not had any research to validate it for practice. But if we are consistently teaching it, it becomes a practice model. Then the gap becomes wider. So let's not go down that path. Lori says, I love the case studies. Thanks so much, Lori. It's a blessing to create them and serve that. Cindy, implementing Tanner's. Watch the video, Cindy. 7 minutes, you'll understand Tanner. There's a link to her article that you can download off the internet, her original model and her framework. And once you see Tanner's framework, it'll make sense. And one of the things that Tanner said that we need to remember as educators, the noticing and the interpreting of the data that's collected is influenced by the caring and the engagement and the empathy of the nurse. So, sometimes what we're losing in nursing education, next gen, clinical judgment. And Tanner brings it back to, yes, your students need to think like a nurse, but they must care like a nurse in order to interpret and to notice the data correctly. Because there are situations where a patient's having increased pain. The nurse can say, be a little disengaged. dramatic drug seeking, and the patient's having a legitimate complication that goes unnoticed, or didn't go unnoticed. It wasn't interpreted correctly. And that's where burnout can kill a patient. When a nurse is burned out, becomes a little jaded, they interpret very differently. And Tanner's framework is something that can really empower every educator to do that. And so Melissa says, I've used several case studies, found them helpful, especially when forced to move class and clinical online. Thank you. And Melissa, it's my pleasure. You're so very welcome. And so Susan says, thank you. The answers are very helpful. Kathy says this, just a closing comments. In fundamentals, when I teach assessment, I use the looking is not seen exercise as a start to noticing. Now, Kathy, I'm not familiar with that activity. If you have a link that you could share, could you pop that in the chat, please? And I'd love to know what you're thinking about that. Looking is not seen exercise. I'm sorry, I've not ever heard of that. So please share that in the chat before we go in the next couple of minutes. And so Carmen says, thank you. It says, Lynn says, you spot on. I teaching new instructors about infobesity and simplify more is not better. I tell them Nurse Keith model. Well, you know, it's basically, I wouldn't say it's a Nurse Keith model, Lynn. It's just basically, I would just say, you know, best practice that Dr. Benner, she's my hero again, who really advocated that very heavily in educating nurses. And it just resonated with me as well. And so thank you for sharing that. And so, yes, and you know, Carrie says this, we use the Tanner model with simulation to help with debriefing. And, you know, Carrie, that is, you know, Lassiter's clinical judgment rubric is based on Tanner's framework. And, you know, so if you're using simulation, using Lassiter's clinical judgment rubric takes the 4 steps of the processes of Tanner and builds on it by deconstructing it with 2 to 3 steps for each process that can be quantitatively measured. And that can be used in both simulation, even in the clinical setting. You can use it as a guide to kind of inform your clinical evaluation as another way of researching out. And so just a thought for you to consider. Kathy says, looking is not seen and listening is not hearing, effective intervention to enhance auditory skills of graduate entry nursing students. So if you've got a link there, that would be wonderful. And I want to thank you again for joining me tonight. That's the end of our questions. I want to thank you. It's been a pleasure. I've loved these and just a chance to connect with you all. I'll be here in 2 more weeks. And thank you again for your time. And I want to bless you and thank you again for all that you're doing to make a difference in nursing and nursing education and teaching and role modeling what a professional nurse looks like to the next generation. Blessings to you, and thank you so much. God bless.